กราบเรียนเชิญแพทย์ทุกท่านนะครับเข้าร่วมเซสชันบ่ายได้แล้วนะครับเรากำลังจะเริ่มภายใน1 นาทีนี้นะครับเดี๋ยวเซสชันบ่ายนี้จะเป็นการคอมบิเนชันระหว่างใช้ High Intensity Focus Ultrasound หรือ High Full ร่วมกับไหมเงี้ยงหรือว่าBarbed Trace นะครับโดยที่Barbed Traceเนี่ยเขาจะใช้ช่วงแนวJawline เพื่อจะแก้ปัญหาเรื่องของ middle กับ lower face lifting นะครับแล้วก็ตัว high full เนี่ยจะใช้ในเรื่องของ upper face ช่วงประมาณช่วงคิ้วขึ้นไปเพื่อยกกระชับในส่วนของคิ้วนะครับแล้วก็อาจจะมี combination กับตัว PTO thread นิดนึงนะครับ
โอเคThank you. Let's go start the afternoon seminar. This time lecture is thread lifting, advanced thread lifting, the convenience therapy. Thread lifting is morning said is thread lifting's goal is sagging skin tissue and antimicrobial thread using the thread lifting. This is meaning using the first is the this is not, is using the cosmetic using. Cosmetic using the thread is change the long-term thread and recently observable thread. Barbed thread is history is 1951 and 20 change the barbed thread. Various product type is aptos and polydioxanone, polylactic acid type is type is brand is endotyne. Endotyne trend is future thread is polylactic acid. Polylactic acid is advantage. First is strength and duration, and potent collagen stimulation. Many thread brand making the polylactic thread is a future thread is polylactic thread. Another type thread, spring thread, silhouette type, cone type thread, and happy lift, and aptos. Now using the brand is Dr. Koch. Dr. Koch is a simple, simple, compatible, fast recovery, max effect. Dr. Koch is the 23 gauge, and thread size 30 thread size. Thread is bidirectional. Bidirectional barbed thread is first. Needle size is 6 and 9. Needle size 6 thread is barbed thread is 3 and 3, and normal PDO portion is 3. Total thread size is 9. Lengthening is 9 because the tangent area is 3, 3. Okay. And what is back? Okay. And Dr. Koch, another thread is high 10 size thread, and 23 gauge thread size is 9 gauge. 9 lengthening is 9 centimeter. Is thread is 4.5 thread, and 4 centimeter is a normal thread. Thread lifting is you choosing the patient. First is the PTOSIS and skin laxity, but severe PTOSIS is not common. We better than the result is the operation and liposuction. Skin laxity patient is making the severe complication is a swing phenomenon. Swing phenomenon is a point is a edge point. Anchoring edge point means a swing phenomenon. Skin laxity severe case is not recommend the thread lifting. Ideal thread lifting case is first type 1. Rated 48 gauge, early shore, submental pad, slight skin laxity patient is your clinic your clinic no complaint patient. This, you choose the patients is this type. This type is Barbed thread type. And type 2 is the good candidate. Moderate jaw, submental pad, moderate cervical laxity. This common point is the small pad. Small pad is the common point, and thread lifting point is mid pace and low pace. Upper pace treatment is not recommended because this thread is anchoring point is low, lower point is a very high effect, but middle point is making the side effect. Side effect is the hyper volume. Overcorrection is iatrogenic moon pace. And poor candidate is type 3, signal jaw, not recommended. This patient is recommended the first liposuction, jaw layer liposuction, and thread lifting. Type of patient is not recommended because making the ear lobe area is a sweeping phenomenon. Sweeping phenomenon is a Barbed type skin. Aging phase is treatment is a vector. Vector is the first aging phase downward vector with treatment upward vector. Upward vector is the first upward vector, upward directional, oblique directional, and medial directional is the anti-aging vector. Patient said, what is wrinkle? My wrinkle is Korean patients say, there is nasolabial fold. There is not nasolabial fold. This line is marionette line. Patient, you definition is the first thing. Patient want area, you explain. There is nasolabial fold. This is marionette fold. Definition is very important. And thread lifting area. First, crop fit. Crop fit is the Barbed thread not recommended because in making the iatrogenic moon pace. Medial portion is highly portion. Patient said that is the good proportion. Thread lifting is the correction of the meaning is the zone correction. Medial side is volume recommendation, volume replacement, lateral side lifting effect. Because this side A, B, medial portion is the volume correction necessary, and CDE area is the zone correction. Zone correction is a volume lift, face lift. You first check the patient is the first point. First point to check is the Barbed thread severe complication hematoma. Severe hematoma chest first, the first point check. Temporal area, temporal pulsation, carotid first, facial pulse check. This area, be careful. And anatomy is you thread insertion area. Thread insertion area, first temporal area, innominate fascia. Because innominate fascia is a very tense area. You anchoring point, subcupid is not anchoring point. I think the ideal temporary anchoring point is duplicate fascia, superficial temporal fascia, deep temporal fascia, and innominate fascia area is anchoring point. That is the important area. This is very severe complication. There is the nerve and sentinel vein. Sentinel vein making the hematoma. Hematoma, this sentinel vein is zygoma 같이 above the 1.5 above area is sentinel vein. Sentinel vein area is middle temporal vein artery running area. Crop-fit and brow area, be careful sign is a sentinel vein. Sentinel vein is making a severe hematoma, delayed severe hematoma. Thread lifting is a complication. I repeat point is the hematoma. You be careful of the vessel and vessel. And second case is Korea doctor is making the nerve injury. Nerve injury area is first in the temporal area. This line is the orbital rim, inferior orbital rim. Tragus line is a Frankfurt horizontal line. Frankfurt horizontal line, 2 cm and 1.5 area is a complicated nerve area. This area not insert side, but this area is very deep. First entry point is superficial and running is deep. Second danger zone is the temporal area. Temporal area is the temporal branch. Temporal branch, be careful. And many accident sites is the marginal branch, marginal trigeminal, facial lobe, marginal branch is a severe case complication. This is the injured, very large nerve, motor nerve. This line injury is using the needle. Using the needle is cut the nerve. You be careful of the nerve. First, you check the masseter muscle and pulsation check. And this is running in the subQ area. Be careful. And dangerous point is a zygomatic branch. Zygomatic branch is a perioral area, very severe pain. But first it protects the parotid gland and zygomaticus major muscle, between sides running. First you running insertion, be careful, and this area is slowly and slowly. Danger zone is protect the parotid gland. This line is check the first thread side. Thread side is this line is optimal side is 7 centimeter because our contouring is round, but thread insertion rate is straight. Straight is short than the round, and optimal side is 7 centimeter. And facial nerve block. Facial nerve block is a 3-finger method. You raise right hand. Raise right hand. Yes. 3 finger. First, supra-orbital nerve. Second, infra-orbital nerve. Third, mental nerve. This is a key point nerve block because it's key point nerve block. And infra-orbital nerve is like eyelid lateral contours, lip corner side is sharp line, but outside is the zygomatic facial nerve. Zygomatic facial nerve is necessary. Facial nerve is the local anesthesia. First is the supra-orbital nerve. Supra-orbital nerve is the glabella midpoint. Sometimes midpoint wide is the 2.7. This supratrochlear nerve area 1.7 glabellar midpoint line, and infra-orbital nerve block is the third tooth straight line nerve block, and mental nerve block fourth tooth. I occasionally infiltration tumescent because is the thread is making the delayed hematoma and severe bleeding. First, tumescent infiltration may prevent the patient pain. Patient pain decreases the no complaint. And this is the marketing. Barbed thread insertion is very severe pain. Tumescent filtration is making the hydrodissection. Hydrodissection is making the 40-degree good candidate patient hydrodissection, and 2 weeks bandage is making the lifting effect. First, in the tumescent infiltration. This is the rule. And quickly making the tumescent. And occasionally, I'm sometimes using mixed 8.8 ACC 8 milliliter normal saline and mixed 2.5 cc lidocaine mixed and epinephrine is a quick tumescent infiltration. Local anesthesia area, temporal area, and vertical portion. This area is a thread insertion site, but patient say, what is happened the lifting? Lifting patient is thread tumescent infiltration patient say the swelling, severe swelling, but 2 weeks later, the tumescent absorption is making the good result. And this area is a tumescent infiltration area, and this point is local anesthesia. Local anesthesia point is first infra-orbital lobula and mental lobula. 3 point is the entry point. Entry point lobula is necessary. Thread lifting procedure is the what is vector? First thread insertion site. I think the for recommended first site is vertical vector because you using the one finger, vertical vector is first, and oblique vector and horizontal vector. Cog vertical thread insertion site and mandibular angle. Plasma muscle is slight touch. Slight touch is the vertical vector, and cog oblique vector is a 30 degree insertion, and mandibular border area. Don't below the rib corner line because rib corner line below thread is making the dimple, severe dimple, and prevents the orbicularis oculi muscle area is prevent. Inner 1cc is not prohibit because motion change. Nasolabial fold correction thread is orbital area 1 cm inner insertion, making the sometimes patient rocking phenomenon. Rocking phenomenon you prevent, you meet the rocking phenomenon, and nasolabial fold is a cut thread because is the thread is anchoring point many severe because anchoring thread is remain is the tension. Lifting point is small is fine, but anchoring point remain is longer than the anchors lifting thread point. But nasolabial fold is you cut the thread anterior side, 1 cc and 2 cc cut thread, and flashing thread is the hairline thread. Hairline inner side thread is not recommended because hairline thread insertion is my clinic opinion. My clinic happen occurred patient the first folliculitis and severe complication infection. Hairline insertion thread is making the complication. As I recommend the skin area. Hairline border is the insertion site. First thread is vertical and oblique insertion. Nasolabial fold correction. Dr. Cog is a composition of 4 thread. 4 thread is I recommend the 4 thread insertion or 3 thread insertion because the 3 thread insertion and you making the balance. You correct the balance, and I recommend 3. One case remain the correct the balance and nasolabial fold thread insertion. And Marion insertion is mid-pace, low-pace treatment. Thread is vertical vector, no. First is vertical vector, and second is lower pace lifting. Lower pace lifting is marionette point. And jawline. Jawline is the many patient this effect is vertical vector. Vertical vector is jawline treatment, and now this case is low SMAS. low SMAS correction is the, you see the perioral area. This is low SMAS. Low SMAS is periorally not changed. Only low portion. And high SMAS treatment is the mid-phase augmentation. Mid-phase abort augmentation is making the volume effect. But high SMAS treatment is patient complain the motion is difficult. High SMAS is the real lifting method and vectoring effect. This is correct vector, but this is incorrect. This is incorrect, but I think that this is the correct. You making the volume reduction. This area horizontal lifting is the making the flat convexity of the mala. Large patient, small patient insert incorrect direction is making the large face. Large face patient, large zygomatic area patients insertion vertical vector thread insertion making the volume augmentation. But this area is very difficult. And prior to say this area is a zone correction. First, volume augmentation. I recommend the volume augmentation. But patient want thread lifting. Thread lifting is insertion. This area is a vertical. And vector effect is the nasolabial fold, marionette fold is the oblique vector. Vector effect is a oblique vector, medial abort vector is making the result is the same. There is design. Design is old design is the hairline but now modified design is a hairline area. Hairline area insertion point you decided. At this point 1, 2, 3, 4, 5 insertion area. And you prevent the complication post-compression. Post-compression is that prevent the complication. Complication is a hematoma is made, thread mobilization, thread infection. You thread insertion, severe compression. And hydrolifting is making the post-bending. Post-bending is making the your thread technique is high. Your effect is better than the no post-bending. Post-bending making the first thread anchoring and decrease the swelling. And thread migration prevent. This is the post-bending. Thread lift, barbed thread lifting is first complication is hematoma and dimple. Dimple is the patient complained 2 months. You waiting for 2 months? No, patient no waiting. Daily complaint. What is dimple? Dimple correction is first is puncture and massage and you insertion area is a keep area. Perioral area not recommend. This area is above the 1 cm inner below site insertion is making the dimple. And you check the patient's previous smile. Smile patient is a congenital dimple. Dimple area is your thread making the severe dimple. You first this area is making the risorius muscle. Risorius muscle area is you check the first smile and thread extrusion. Thread extrusion is a severe complication. Is in a 3 weeks in a later 3 weeks later happen. This is what is first your thing is not pull. Yours not pull and not anchoring. And your thread is slightly tightening. And this is the correction is a removal. This is removal. First, you remain the posterior external site is severe complication. First, scar, and PIH, and this site infection. Infection is a thread line infection, and another side infection is a hidden infection. And this is a treatment. First is removal, and continuous antibiotics, and undercorrection. Undercorrection is a complication. You touch-up program. Your clinic making the touch-up program because it's a thread is not thread. Thread is not permanent. Your lifting effect, lifting energy is low. First time effect is the swelling. Patient is a muscle area is severe movement. Severe movement is the downward. And my clinic is a 2 months later correction program, touch-up program, and overcorrection. Overcorrection is the first waiting, and second removal. Patient complaint is daily complaint. This is complication. This is a QT complication, but there is complication. Conclusion: Barbed thread is short time procedure, healing the more natural type, and rapid recovery. Rapid recovery first is your technique. Your technique, gentle technique is rapid recovery. Your top techniques make the hematoma and nerve injury and dimple, and inexpensive, easy, but thread repair is not permanent. This is not operation. Patients explain this is not operation. This is a procedure. Procedure is your satisfaction low expectation, and you want the more lifting. I'm playing the touch-up program, and thread lifting is making a good result. Is the first combination therapy, filler augmentation, and toxin relaxation, and laser therapy. And this is the machine. The hype is recommend, but my friend is Robert White. Is John Hawkins. John Hawkins said is sometimes the combination therapy is not recommended because what is in complication is thread or hype. Same time is not recommended. First, hype same time procedure make the complication is hematoma because the hype is making the somal damage. Somal damage is the circulation is very high response and making the growth factor. Growth factor is making the bleeding tendency. It's not recommended, but thread first, 2 weeks later, hype recommend. Sometimes my clinic is foreign patient is want the ulcera and thread lifting, but this marketing point is the same time, but that is not recommend because it's a hematoma. Hematoma is making the not predictable. Thank you. I see the procedure and you explain. Okay, thank you. Any other question?